Good evening to everyone and welcome to today's session. Yesterday we have discussed trigeminal nerve, almost 70 MCQs in the past 15 years of the All India Dental Entrance Exam, postgraduate dental entrance. The questions we are now reviewing, the question bank of the basic sciences. There were also questions from the topic of arteries, followed by the trigeminal nerve, which is a most frequently asked topic. Now we have the next topic to discuss, that is facial nerve. Let's make the great beginning of the facial nerve. Yes. The buccal branch of the facial nerve, what does it basically supply? The buccal branch of the facial nerve supplies orbicularis oris and buccinator muscle is what you need to remember. So, how many branches do you know in the facial nerve? Facial nerve terminally divides into a temporal branch, zygomatic branch, buccal branch, marginal mandibular branch and a cervical branch into the neck is what you have to ultimately remember. So it is that buccal branch which is the one which supplies the muscles which are around the cheek and the above the mouth. They are the ones which are supplied by the buccal branch. What is the afferent and efferent of the corneal reflex is one of the favorite question of the examiner. So you should remember, doctor, you have a afferent. Afferent is the one which carries the sensation from the orbit, the eyeball, from the cornea. That would be the trigeminal nerve. The moment you touch anything on the cornea, the trigeminal is the one which carries it, and in turn the interneurons stimulate the facial nerve, and facial nerve is the one which makes the eyelid to get closed. So the efferent is the facial nerve, the afferent is the trigeminal nerve is what you need to remember. Now let us look into the same story more clearly. Good to see few of you joining the session. Today we started it a little bit early. Yeah. So doc, this is the Bowman's layer and this is the Decimet's membrane, and here from the cornea, the trigeminal's ophthalmic division, this is the one which carries the sensation all the way to the brain. Then you have a spinal trigeminal nucleus. From the spinal trigeminal nucleus, which is located in the pons, the information is passed on through the interneuron. The information is passed on from the trigeminal nucleus, spinal trigeminal nucleus. It is passed on to the facial nucleus, and the facial nucleus takes a curvilinear route around the abducens nucleus. This is a favorite question. This is called as the facial colliculus is the name which is being given to this. Facial colliculus. So the facial colliculus, so the facial nerve comes back and it is the one which makes the eyelid to get closed, which is the efferent is what you need to remember. Another way to say the same, the facial nerve, that is the temporal branch of it, it is the one which is the efferent, whereas in the orbicularis oculi, that is the one which closes the eyelid, and you have the nasociliary branch of the ophthalmic division of the fifth cranial nerve. That is the one which is connected with the semilunar ganglion, and that typically reaches fifth cranial nerve's spinal nucleus Yesterday we have discussed in a great detail the entire trigeminal nerve, which is called the dentist nerve, right? So from there, the interneurons of the spinal nucleus will pass, reach the facial motor nucleus, and they are the ones which are the efferent, is what you have to ultimately remember. So this is how, by touching with a wisp of cotton, you will be typically creating the afferent stimulus transmitted through the trigeminals of thalamic division is what you need to remember. So this is the orbicularis oculi muscle. It is the one which is being supplied by the 7th cranial nerve. And this is the ophthalmic division of the 5th cranial nerve, which is carrying the afferent, is what you should remember. Now the patient who is having a facial injury in the stylomastoid foramen, what will he be showing? What will he be showing? Obviously, in the stylomastoid foramen, if there is any injury to the facial nerve, then all this temporal, mandibular, zygomatic, buccal, all these branches get affected. So that is the reason he shows the loss of the corneal reflex, because the facial is the efferent which is supplying the cornea, is what you have to ultimately remember. Good to see 5 online students. Can you please punch whether the voice is loud and clear, doctor? So today I have started the class a little early, right? So now the facial nerve nuclei, there is a main motor component. There is a visceromotor component which is called suprasalivatory nucleus. Where did you listen the word inferior salivatory nucleus? Glossopharyngeal nerve is associated with the inferior salivatory nucleus, and suprasalivatory nucleus is by the facial nerve. That's what you need to remember. Then there is a sensory nucleus which is common to 3 nerves. For 3 nerves, there is a common sensory nucleus which is located in the spinal cord. What is that, doctor? Nucleus tractus solitarius. What are the 3 nerves? Remember, N is 9th, glossopharyngeal. T, 10th is vagus. S is 7th. For all these 3 nerves, there is a common sensory nucleus which is called as nucleus tractus solitarius, is what you have to ultimately remember. Then there is a general sensory nucleus which is closely related to the upper part of the spinal nucleus of the trigeminal nerve. So these are the 4 nuclei, doctor, that the facial nerve is having, which you have to emphatically remember.